Hi, Assalamualaikum, and a very good day to everyone. My name is Eshaby Mustafa, and today I am going to present a paper entitled The Dietary Changes and Food Preparation Among Malaysian Households During COVID-19 Lockdown. This paper is authored by me and co-authored by Professor Madya Dr. Nur Azimin Zainal, and we are from the University Utara, Malaysia. We are presenting this paper for the 4th Langkawi International Multidisciplinary Conference 2021. The COVID-19 lockdown in Malaysia resulted in disruption to everyday life, including changes in grocery shopping, cooking, and eating. Individuals are spending more time at home and consuming food and meals that would otherwise have taken place in a different setting. The development and spread of this disease culminated in a COVID-19 pandemic, causing enormous social, health, and economic upheaval. In an attempt to halt the spread of the virus, government worldwide enforced social distancing measures, including lockdown that sought to reduce the movement of and contact between people. The curfews, quarantines, stay-at-home orders, and shutdowns are all global versions of lockdown, with only critical companies authorized to remain open and schools, public buildings, and the bulk of workplaces compelled to shut. Everyone was asked to stay at home to break the chain of transmission of the virus, leaving their household only if they were essential workers. Restaurants, cafes, takeaway shops, including fast food restaurants, fruit and vegetable stores, bakeries, and butchers were closed. Supermarkets and other essential shops were open, but with physical distancing measures in place. This figure explains about all the phases of the movement control order in Malaysia, starting with MCO phase 1 from the 18th to the 31st of March in 2020, and this has taken place along 2021 until now 2021, with the total lockdown from the 1st of June 2021 this year until the 28th of June. There can be several issues that could explain why we wrote this paper. The trends related to food during lockdown. The physical access and affordability of healthy food is seen to be a problem to most of the households in Malaysia. Disruption to cultural and social food practices, and where supermarkets and food outlets struggle to meet the increased demand, with many running out of necessary food supplies. We can also witness online shopping slots for pickup or delivery were full several days or weeks in advance. Online food deliveries continued and reported record numbers of new members. We can also see that panic buying and stocking up on goods, including groceries, happened. The next problem was the increased stress and unhealthy food intakes. Throughout the epidemic, according to Kolho Ravagnani et al. In 2020, the international public health advice on nutrition has been to consume a diet rich in fresh foods. Further, intakes of sugary drinks and processed food high in calories and salt must be limited. It was also advised that optimum nutrition is important for mitigating the risk of morbidity due to COVID-19. However, the psychological consequences of lockdown, which includes the increased anxiety, tension, irritation, bewilderment, rage, and boredom, and divergence from normal routines, may result in overeating of unhealthy foods, which may aggravate obesity and raise the risk of cardiovascular and metabolic illnesses. This is according to Butani and Cooper 2020, Martinez, Ferran et al. 2020, and Mattioli et al. 2020. The home-cooked meals. Home cooking is typically seen as healthier than dining out. Eating out has been related to obesity and eating less vegetables, but home-cooked meals often include lower total kilojoules, carb, fat, sugar, and ultra-processed food. However, it is unknown if these general results concerning home cooking remain true when the community is compelled to cook at home, such as during a pandemic lockdown. Therefore, this study aimed to capture the changes in behaviors and perceptions of food preparation during the lockdown and understanding the dietary patterns and changes during this period. The research objective for this study is to explore the changes in dietary patterns during COVID-19 lockdown in Malaysia And secondly, to understand the behaviors and perception of food preparation during COVID-19 lockdown. The research question remains, what are the changes in dietary patterns during COVID-19 lockdown in Malaysia? And what are the behaviors and perception of food preparation during COVID-19 lockdown? Some of the literature review was conducted to see the dietary changes and patterns during COVID-19 lockdown. The COVID-19 pandemic is likely to serve as an impetus for changes in food environment, and the frequency of short meal times has been associated with many benefits, including healthy eating, especially fruit and vegetables, and overall diet quality. Other studies using survey research during the first couple of months of the pandemic also found changes in eating habits, such as the increased processed food, snack food, and fresh food in the home, as well as changes in parent feeding practices, such as increases in restriction, monitoring, and pressure to eat. The food preparation during COVID-19 lockdown. The unexpected isolation due to coronavirus disease showed that leisure is important, and people can still find ways to be together. Culinary activities have begun to be seen as an opportunity for many people to get away from a problem. Gammon and Ramshaw in 2020 stated that in a period of enforced lockdowns and social distancing, people resort to nostalgia-based leisure activities such as baking bread and making fresh pasta. For this study, we employed the qualitative approach. We used a set of interview protocols as the instrument, and we conducted an in-depth interview with 12 respondents. The interview was conducted via online using Zoom platform, and the interview session took place between December 2020 and February 2021. The respondent were contacted through a local community WhatsApp group, snowball sampling, and word of mouth. The inclusion criteria for the selection of the respondent include any adult individuals required to stay at home during COVID-19 pandemic in Malaysia with access to internet, responsible for food preparation, and Malaysian age 18 and above. These are the listing of the 12 respondents. You can see they come from various backgrounds and from several kind of careers. Most are married with children, and we do have single respondents as well. The interview protocol includes questions such as asking the respondent to describe their everyday food consumption during weekdays and weekends during the lockdown. How are you eating differently compared to before the lockdown? What are your strategies when making food decisions during the lockdown? If you think you have spent more time in the kitchen than in the past, could you please share with us the factors that motivate you to do so? What kind of benefits do you think spending time in the kitchen during the lockdown period brings you? How do you perceive food preparation strategies during the lockdown? So the process for the qualitative data analysis include interview transcribing, coding, and thematic analysis, where codes are placed under sub-themes and main themes. The interpretation of the codes in regard to the themes were made separately. So these are among the themes that emerge from the interviews. The first is the changes in dietary habits and patterns, where the sub-themes was increase in food consumption. Among the response was, the children would go to the fridge and eat more things because they are at home a lot and has nothing to do. I have to buy more food because they eat a lot more at home now. I spend more time at home and I feel hungry most of the time. I think I was bored, so I eat frequent. I make more types of food now because the children really love my food. I want to spoil them. The second sub-theme is increased and more regular meal times. We would normally eat at breakfast very early, then snack before lunch, and then we will have something late afternoon, dinner, and some fruits before bedtime. We eat the whole day actually. Before this, I often skip breakfast because I need to get to work early. But now I have more time before I start the day, so I will have regular breakfast, lunch, and dinner. The third subtheme is increased snacking. I bought more snacks. They are fast and cheaper compared to other foods. Yes, I eat more snacks now. They are easily available and convenient for me. The second theme is behavior interception and food preparation. The sub-themes from this is increased food preparation time. I spend at least 3 hours a day in the kitchen now, 4 hours if I am baking. My son and daughter will help out when we are in the kitchen, so I will spend more time preparing the food because I love being with them. Perception of food preparation. I cook to avoid boredom, and cooking makes me happy. The lockdown is a boring time away from our work and we cannot leave home. It was quite fun to spend this period in the kitchen and preparing the food because you don't feel how time flies. I don't feel too much stress when I cook, and I am more motivated when I cook something that look and tastes really good. The next sub-theme is increased awareness on food safety during lockdown. I noticed the fact that I was very careful when handling food because I worry about the COVID-19 outbreak. I clean my hands more regularly before and after touching the food. I wash the food thoroughly and inspect the food before I cook them. I have to be very extra careful. I cook more because I don't want to go outside to buy food. I have to be careful about how the food was made, just in case the cook is infected with the disease. Cooking my own food is much safer. The discussion on the themes that emerged from the interview was the lockdown setting resulted in an overlap in eating and meal times. People were rushed to create new eating patterns, including healthy and unhealthy habits. This study demonstrated how the COVID-19 pandemic's lockdown impacted Malaysians' dietary environment. During the pandemic, people altered their eating habits, snacked more throughout the day, and had more meals together. It was revealed that the participants perceived the time they spent in the kitchen during the pandemic lockdown period as a leisure recreation experience. It has been observed that people who started to spend time in the kitchen to be relieved from the boredom caused by staying closed in at home turn to cook the dishes they have not tried to cook before due to the abundance of free time, and they perceive this activity as a quality time spent with their loved ones. In addition, the situational health and hygiene expectation arising from the pandemic also directed people to the kitchen. The limitation for our study is this study could benefit from a much diverse respondents across different age groups, gender, and etc. A comparison study of how demographic characteristics influence the responses was not conducted. And we feel that face-to-face interviews is the most accurate method for the most comprehensive inferences in accordance with the nature of qualitative research. However, due to the pandemic and lockdown, we weren't able to conduct a face-to-face interview. As a recommendations, for this study, a quantitative study may be conducted to a larger setting using food diary, for example, as an instrument to appropriately record all dietary intake. And future study perhaps could concentrate on reducing the possible long-term physical health consequences of overeating and sedentary behavior during the epidemic, as well as the developing the sustainable eating habits that may be applied to similar times in the future. Consequently, it is possible to say that food preparation activities were considered as an important leisure activity with our loved ones during the COVID-19 pandemic period. Especially for those who suddenly face a lockdown almost no one is accustomed to. As Malaysia begins to transition to a new normal, a return to healthier eating habits should be the focus of public health efforts. With this, I thank you and I would welcome any feedback from everyone. Thank you and see you all again next time. Assalamualaikum.